Title IX of the Education Amendments of 1972 is a federal law that prohibits sex discrimination in education. It states that no person in the United States shall, on the basis of sex, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any education program or activity that receives federal financial assistance. Though often thought of as a law that applies to athletics programs, Title IX is actually much broader than athletics and applies to many programs at Southeast Missouri State University. Though compliance with this law is everyone's responsibility at Southeast, there are a few staff members who have primary responsibility for Title IX compliance. The Title IX coordinator's duties and responsibilities include monitoring and oversight of the overall implementation of Title IX compliance at the university. This includes coordination of training, education, communications, and administration of the grievance procedures for faculty, staff, students, and other members of the university community. The reporting Title IX violations is important. Southeast is also committed to providing support and counseling to those who have experienced sexual assault, dating violence, or stalking. The Campus Violence Prevention Program raises awareness and promotes the primary prevention of interpersonal violence to create a safe campus community. Interpersonal violence includes sexual violence, dating and domestic violence, and stalking. Sexual violence is any sexual contact or sexual intercourse that occurs without effective consent. Effective consent means that every person involved is of the appropriate age, has the capacity, and utilizes their own free will to consent to sexual activity. All three, age, capacity, and free will, must be present for consent to be effective. Consent is not the absence of no, but the presence of yes. Domestic violence is any verbal, physical, sexual, emotional, or financial abuse that occurs within the home or between family members. Dating violence is any sexual, verbal, physical, financial, or emotional abuse that occurs within the context of a current or former romantic relationship. Warning signs include extreme jealousy, controlling behavior, cruelty to animals, hypersensitivity, blaming others for their problems and feelings, and isolation. Stalking is a series of events or actions that causes a person to feel afraid or in danger. A stalker can be someone that the victim knows very well or not at all. Persons between the ages of 18 and 24 experience the highest rates of stalking, and perpetrators often use social media and technology to assist them in their stalking behaviors. If you or someone you know believes that you're the victim of stalking, trust your instincts and take any threats very seriously. The coordinator for the Campus Violence Prevention Program provides education and training to students, faculty, and staff regarding the nature and dynamics of interpersonal violence and bystander intervention. In addition to primary prevention, the coordinator also serves as the primary advocate for students who have experienced interpersonal violence and their allies. This means that if you or someone you know has been the victim of sexual violence, dating or domestic violence, or stalking, the Campus Violence Prevention Program can provide crisis support, as well as follow-up counseling and case management. The coordinator can also provide information and support regarding seeking medical attention after an assault, filing a report, off-campus resources, creating a safety plan, and the campus judicial process.
The Office of Student Conduct at Southeast Missouri State University takes reports of interpersonal violence very seriously. Students who file a complaint have the right to be as involved or as uninvolved in the investigation and hearing as they would like. And we make every attempt to protect the victim or complainant in these cases during the investigation. The Office of Student Conduct works with local law enforcement and/or university police if a report is filed with one of those agencies. We also make an independent decision about whether university charges will be filed. It is possible that a case can continue at the university level even if criminal charges are not filed by the prosecutor. If you or someone you know has been the victim of a sexual assault, domestic violence, dating violence, or stalking, the options for reporting those incidents on campus are with the Department of Public Safety, the Dean of Students Office, or the Office of Student Conduct. If you have questions or need more information about any of these issues, please contact our office.
If you've been a victim of sexual assault, get help by contacting the Campus Violence Prevention Program, the Campus Police Department, or the National Hotline. Seek medical care as soon as possible by contacting Beacon Health or Southeast Hospital. In the event that you do seek medical care, someone from the Campus Violence Prevention Program can be there to support you. Remember to protect any evidence. This means try not to brush your teeth or hair, wash your face or body, use the bathroom, or eat, drink, or smoke anything. You'll also want to consider your legal options. You can do that by contacting the Office of Student Conduct or the Cape Girardeau Police Department. Creating a safety plan can be vital after a sexual assault. Create a plan with friends or a counselor to avoid future contact with the perpetrator. And remember to take care of yourself. Healing from sexual violence is possible, but takes time. Be patient with yourself and ask for help when you need it. You can always contact the Counseling and Disability Services Office. If someone you know has been a victim of sexual assault, believe them. Oftentimes, the most important step for recovery is whether or not a survivor is believed. Listen, let them vent their feelings without asking probing questions and without sharing your feelings first. And know your limitations. It's hard to know that someone we care about has been hurt. Refer them to a counselor and perhaps see one yourself.